wake up at 3 in the morning, I'm in Chicago, and I find out, like, Mr. Bucket List is on my set. I am of all men cursed. Yeah. I am of all men cursed. Anyway, very excited to have with us Rock and Roll Hall of Famer and member of 12-time Grammy Award winner Paul Simon, together with Dr. Irwin Redlener. They're marking the 25th anniversary of the organization they founded to provide health care to the kids in need, the Children's Health Care Fund. Gentlemen, it's a great honor to have you both here. Of course, not only, Paul, because of the remarkable music that you've provided us for so long, but also 25 years of this organization taking care of children in need. Talk about what's happened over the past 25 years and what you hope to accomplish over the next 25.
Well, first of all, thanks for your kind words, Joe. Sorry that you're in... What are you doing in Chicago?
I'm cursed. I'm just stupid. I mean, I'm always in the wrong place at the wrong time.
I heard that.
He thought this weekend was Lollapalooza.
Yeah, I know. I thought I was going to meet my son for Lollapalooza. I find out it's 2 or 3 months ago. But anyway, yeah, I'm in the wrong place at the wrong time. So I'm Dr. John here. Mm-hmm. So, but talk about your organization and what's happened over the past 25 years.
Well, it started with an explosion of homeless people in, not a literal explosion, but a proliferation of homeless people in New York City in the late 80s. And Dr. Redlener and I met because I was trying to get some money from USA for Africa, the Michael Jackson video that I was in, to give it to a homeless shelter on the west side of Manhattan. And Irwin's interest is children's health care, pediatrics. And we went around the city and saw the single-room occupancy hotels and saw the situation of what was going on with homelessness and how it affected children. And it was... honestly, it was like the third world. It was just mortifying. And so we came up with this idea to have a mobile medical clinic that would go to the various sites and provide health care with a doctor and a nurse on board and a computer records. And we were associated with a hospital in New York, and that's how we began. We started in Manhattan, and then we went to a few other boroughs, and now we have 50 units around, all around the United States, in urban areas and in rural areas. So that in a nutshell, is our story. There's been, since we started, there's been 3 million doctor-patient visits over these 25 years.
You guys, I know, have been working this issue for a long time. We talk about presidential campaigns and how a lot of big issues don't get talked about. This is one of them. How frustrating is it for you to be watching this campaign play out in 2012 and have this issue that means so much to you never mentioned, not ever really discussed in any substantive way by either party or either candidate?
Yeah, well, let me say a word about that, John. This is a really important question, and we actually have been speaking to the campaigns and trying to get both of the campaigns to say something in terms of their plans for what they're going to do about not just access to health care for all children, especially poor children, but access to all the safety net programs, from hunger support and early education and so forth. And in fairness, the last few years have shown some significant growth in some of the strength of these programs and expansion of programs for the poor under President Obama. That said, we really would like to see more articulation of this as a major issue for the U.S. And the thing about children in poverty is it's very different from the situation with adults, because with adults, people are enduring situations that they should not have to. But for children, not only they are enduring conditions that are horrendously adverse, but there are consequences, because if kids are not getting the health care they need and not getting nutrition and so forth in the early brain development years or while they're in school, then we see an unfolding disaster will affect not only our present but our future.
Hey, doctor, could I interject here? Isn't that something that we figured out over the past, you've been doing this for 25 years. It seems 25 years ago you would hear a lot of studies saying, if you don't get to kids before they're 5, then they're going to be problems for the rest of their lives. It seems the more we learn, the more we begin to understand that that age gets bumped back to 4, to 3, to 2. If we don't make the investment to help these children, these babies, these toddlers develop in their first 2-3 years of life, then they're going to be deficiencies in a lot of cases for the rest of their lives. It's critical we get in as early as possible, right?
No question about it. I have a niece that teaches at Bed-Stuy at a first grade class in Bedford-Stuyvesant in New York. And she was telling me just a week ago about children who fall asleep, 6-year-olds fall asleep with their heads on their desk. Children have been labeled as learning disabled when they don't have visual problems. Well, the kids falling asleep turn out that they have asthma that has not been identified or treated. So these kids are destined, in many cases, to be failures or not reach their potential, and that's really a disaster for the country. And this is why that word that you used, investment, is so key here. Paul always talks about children as a treasure of America, and they are, but they're also a critical investment, just as important as anything else we're going to do economically. It's one of the reasons that we're hoping that this election season will see a lot more focus on children as investments in America's future.
And if you don't make that investment early on, you're engaging in a false economy, because you're going to be paying out a lot more in the out years, whether it's Medicaid or other government services. So when we were about to introduce you, Paul, we knew it was the 25th anniversary of your organization, but somebody also said in my ear, you know, it's also the 25th anniversary of Graceland, which tells me how last year, but I guess there's a documentary there. I thought that came out like a year or two ago, which is how old I am. But 26 years ago, and it still is having a significant impact. Your album last year, So Beautiful or So What, critically acclaimed. How do you know, there are a lot of people that have their hits and then play those hits for the rest of their lives and don't keep growing. How do you keep getting up and producing great music day after day, or using sports analogy, inning after inning after inning, getting up for the next inning?
Oh, nice of you to say. Well, for one thing, I'm really not thinking about hits anymore, and actually I wasn't thinking about hits when I was making Graceland. I certainly didn't think, I know a great idea, I'll go to South Africa and record and the whole world will fall in love with it, but that is what happened. But I'm just trying to keep myself interested in my work. That's really what goes on, and the fact that other people are interested is gratifying. But I'd be doing it, always was doing it for myself, and I still really am.
You know, Joe brought up Graceland, and I think, you know, just to, we talk about, as Joe said before, we talk about politics and music, and there's very few records that have intertwined politics and music quite the way that Graceland did. You know, you violated the UN cultural boycott to go make that record, and then just a few years later, you were there, the first artist invited to perform when Nelson Mandela came out and post-apartheid South Africa. I know that's one of your favorite shows. Talk about what that record means to you, because it really was something that kind of, I don't want to say it changed the world, but it opened up a lot of people's ears to music from a different culture they had never heard before. It had that big political impact. Just talk about that and what that means, and what, in the context of your whole career, what kind of impact that had on you.
Well, it was the great teaching experience of my career, because I really began to learn about rhythm. I was always drawn to rhythm, but playing with African musicians, and then later with West African musicians and Brazilian, that was great. But what was, in retrospect, what's most gratifying is I always had this idea that the cultures were not as separated as we perhaps imagined. And that comes from early rock and roll, listening to it. When you take country music and the African American experience and you combine it, you're taking really different cultures and you're putting them together, and that was rock and roll. And the Graceland experience was very similar. There were places that connected American music and South African music, and we found those bridges, and and we built, a hybrid that worked, and it worked as an example, and it had political implications as well, so that I couldn't foresee at the time, but they turned out to be a good teaching device as well. So quite an extraordinary thing in my life to have, done Graceland.
Yeah, for all of us.
Absolutely extraordinary for all of us. You're right. Now, I remember, speaking of early rock and roll, I remember Paul, Rolling Stone interviewer, asking you for the greatest line in rock history, the early 80s. Your answer, Bebopalua, she's my baby. Bebopalua, don't mean maybe. Do you stand by that all these years later?
I just listening to it now, I feel like I may have had some antagonism towards the reporter or the question.
Okay, very good. All right. And that continues. Paul Simon, thank you so much.
Thank you, Joe, for having us.
It's great to have you guys here. Doctor, thank you so much as well.
Thanks,
and
Joe.
We thank you for what you've done over the past quarter of a
25th
century.
anniversary concert that Paul's doing is a week from today.
Yeah, that's true.
All right. Well,
Thanks.
Where do I get tickets out there?
Heilman and I will be there throwing things on stage,
Let us
hoping
know.
to get a closer view. All right, coming up next, Business Before the Bell with Brian Sullivan. We'll be right back on Morning Joe.